meeting. All right. Great. So once again, welcome to our information exchange meeting. For those of you that don't know what Healthwatch is about, we are the local health and social care watchdog. We collect patient feedback so that we can suggest improvement to the local health and care services where possible. But apart from this, we also provide people with signposting information about what services are available, how they can access them. But we also educate people on their patient rights, and we help health professionals to bring awareness of the different health issues so that people can make informed choices about accessing the services. And this is one of the reasons that we are running this information exchange meeting today, not to tell people go and vaccinate your child, but to tell them why they should vaccinate their children, why they should consider this. And the reason I'm saying this is because while we were promoting this event, as we received, thank you messages from people to say thank you for running this event, we also received a couple of kind email from residents who were clearly saying, do not use me and my children as a guinea pig, as an NHS guinea pig, which is, I guess they all have their reasons for saying that. But this is exactly why we are running this meeting, to let people know why it's beneficial for them to vaccinate their children so that they can make their own choices. Thank you for listening to me. I think now the time is to let our wonderful speakers tell us about child vaccination. So these are Dr. Taksing Khan, who is a local GP and a clinical advisor at the NHS England as well. And we have Brian White, who is the Childhood Immunisation Program Manager for City and Hackney. I will, Dr. Khan, if that's okay, I would like to let you go first.
Sure. Thank you. Thank you so much for allowing me the opportunity to talk to you all about vaccination. So I hope you can now see my screen.
We can.
Perfect.
I mean, I can.
Great. Okay, so my name's Tasim Khan. I'm a GP up in North Hackney at Spring Hill Practice in Stamford Hill. I'm also clinical director of the primary care network there, which is a collection of 3 GP surgeries. So there's Spring Hill Practice itself, the Stamford Hill Group Practice, which is just up the road, and then Cranwich Road Surgery. So all in the north of the borough. And it's very interesting area of Hackney, in that we have 40% of our population is around 40 to 50% is from the Orthodox Church community, but we have the full breadth of different communities and a lot of diversity in our 3 practices, which is makes it a very interesting area to work in. And I'm here with my colleague Bryn, who'll be talking later on in the slides, and I'm sure he'll introduce himself when he speaks to his slides. So as was mentioned, what we really want to do is try and impart as much information around vaccinations, childhood vaccinations in particular, because we know that there's a lot of information out there. There's also a lot of misinformation out there, and sometimes it can be difficult to try and discern what's the right kind of information and what perhaps is less science-based information that perhaps is more misleading. So my aim, and I always say this at the start of every webinar, is not to convince anyone to have vaccinations. It's to try and provide the information based on scientific research and medical research and evidence, and also medical practice, for you to be able to then take that information and make an informed decision for both yourself and your family. And that's really all I want to try and achieve. So we'll talk about things like why vaccinations are important and how they work, whether they are safe for your child, how to have vaccinations and when to have them in particular, and the importance of having them on time. And then just some practical tips about what to do when you take your child to have a vaccination. What kind of things should you be aware of? And then my colleague Bryn will talk about the uptake, because we have a particular issue in City and Hackney, actually, with very low uptake of vaccination for childhood immunisations, leading to a few problems, which I'll talk about. But the key thing is what I really want to do is try and answer any questions that you might have around childhood immunisations or immunisations more generally. I'm also happy to talk about and answer any questions or any concerns that you might have. So first of all, what are vaccinations? So vaccines are substances, so they're parts of protein. So either the coat of a virus, which is a type of germ that causes infection, and they've basically been treated so that they're not risky at all in terms of then injecting you with this substance. So these are all either dead viruses or just a part of their coat. That makes your body recognize that this is an invader, if you will. It's something that shouldn't be there. It's a germ that's going to cause disease. And then what your immune system, so your defense mechanism, your way of fighting these germs, what the white cells do is they recognize that this fragment of a virus is an intruder, and they kill it. And they also, importantly, the other thing they do is produce antibodies, which are really important proteins, so a natural substance that then remembers that virus or that bacteria, so that then in the future, if you ever encounter that virus again in real life, not in an injection, your immune system, so your antibodies, are activated, and even without you knowing that you've encountered it, that bacteria or that virus is killed and you don't become unwell. And so it's a really effective way of trying to fight serious infections and trying to protect yourself and your children from them. So another important thing is that they only contain a killed or very weakened form of either viruses or bacteria. And I really want to stress that point, because often people say, for example, when it comes to flu vaccine, oh, but the flu vaccine actually gave me flu. But that's actually not possible, because actually it's a very small part of the coat of the virus. So yes, it can give you side effects short term, or you might have had a cold at the same time as having the flu vaccine, but there is no risk of you developing the illness as a result of having the vaccination, so they don't cause disease or its complications. And so this is a diagram of how vaccines work. So just what I've talked about in a nice picture. So as I said, the vaccine itself is a weak or inactive form of the virus or bacteria. It's then picked up by your immune system, and these green things on the cell named numbered number 2 are the antibodies that your body produces. And then the next time you encounter it, that defense system kicks in, and you fight it straight away. So another question that gets asked frequently is, what's in a vaccine? Is it safe? What are the ingredients in it? So they are actually, the majority of what's in a vaccine is water, and it's about 99% water, alongside the antigen. So what we mean by that is the weakened form of the virus or part of the coat of the virus, so that your body can recognize it. There's also chemicals that help boost our immune system, so they stimulate your immune system to make it work more effectively. These are safe substances that are used routinely, and you encounter them in food and drink and the environment otherwise as well. There's also preservatives to make sure that the vaccine stays safe and also effective for as long as possible. So again, these are natural. These are things that we encounter on a daily basis, and nothing dangerous in there. And lastly, there's stabilizers, which make sure that when the manufacturer makes the vaccination, it's stable enough for it to go from the factory to clinic settings. And if one of the kind of less stable vaccinations, for example, was a COVID vaccine early on, where if you remember, you could only have them at specific vaccination sites, and that's because it was quite an unstable vaccine, and it couldn't go like your flu vaccine from one clinic to another. It had to be given at specific sites, but they are also becoming more stable with advancements as well. So a bit about why you should vaccinate. So we know that vaccinations, and I've said this previously, is that they are the safest and most effective way of protecting yourself and others against serious infection. And you know that there is a beauty in this, in that when you get vaccinated, or when your child gets vaccinated, for example, for flu, which again in City and Hackney we do have particularly low uptake on with children having flu vaccination. But actually what's important to remember is that actually flu can make children very sick, particularly young children and babies. But more than making them sick, if they go and see their aunties and uncles and grandparents, it makes them very, very sick because they've got weakened immune systems. So the beauty of vaccinations is that not only does it protect you, it protects others around you. So there is a social benefit to protect your loved ones by having the vaccination. Also, another example would be there are certain instances, for example, if a child is having chemotherapy, they're not able to have the measles, mumps, and rubella vaccine because it can cause complications. So we don't offer them that vaccine whilst they're having chemotherapy. And actually what it requires is people around them to be vaccinated to protect them, to keep measles at bay. Because obviously with a weakened immune system, and if you are having chemotherapy, you'll have no immune system whatsoever. If you get measles, you will become very sick and you might die from it. So it's the most safe and most effective way to protect yourself and others. And actually, it's been cited as, after clean water and sanitation, the most effective way to save lives and keep people healthy since the start of time. Which I think is a really powerful thing. So yes, sewage and clean water has saved lives, but after that, vaccination has saved the second most number of lives across the world, and it continues to do so. And vaccinations have also been around for hundreds of years, since the 1700s, when accidentally it was kind of tested, and there was an association where people with certain types of pox, so smallpox, were protected if they'd had a different version of the disease. And so we've known about the theory of vaccination for hundreds of years. So they are very rigorously tested, and nothing gets to clinic settings without it going through huge numbers of test patients. I mean, I, for example, was one of the test patients for the AstraZeneca vaccine when it was first launched. And, you know, even that, I know we're talking about childhood vaccinations, but it was tested on tens of thousands of people across the world from a variety of background. And it's only after they tested it for, you know, for a long time that they managed to produce the vaccination itself. And we know childhood vaccinations have been around for decades and much longer than the COVID vaccine. So we know that they're tested and we know that they're safe. So one of the key things to remember is, and one of the things that I hear from parents is about being worried about multiple vaccinations in one go. So there's one vaccine where there's 8 different vaccines in one injection, and parents worry that you know, that's overloading the immune system, you know, for their child. But what's really important to remember is that we're exposed to tens of thousands, if not millions, of bacteria, viruses on a daily basis, particularly children. I mean, they're always putting things in their mouth. And so their immune system is fighting millions of viruses and bacteria on a daily basis, and it copes absolutely fine. And if anything, it's a good thing. Their immune system is learning. So even if you have 8 vaccines in one go, that will not overload your child's immune system. And they'll be able to make healthy responses to all the different vaccines at once. And we know that children that are vaccinated get fewer both infections of vaccine preventable diseases, but also generally other infections as well, because their immune system is healthier. Another thing that I hear from people is that we don't see diseases anymore that we vaccinate against. So things like whooping cough, measles, mumps, rubella, etc., that these are old diseases that don't occur. And unfortunately, particularly in Hackney, that's not the case. So at the moment, we're seeing whooping cough, which there is a very effective vaccination for, and it can be particularly risky for pregnant women and very young babies, because it can cause respiratory distress. It can mean that they end up in hospital needing life support because of problems with their lungs. Equally, measles, we used to see in the Victorian times, and then since the start of the measles, mumps and rubella vaccine, the number of cases have gone down. But unfortunately, back in 2018, we had around 300 to 400 cases in Hackney, and we are seeing isolated outbreaks across London of measles, which is worrying, because we know that vaccination uptake has reduced, which Bryn will talk about in more detail. And also last year there was, I'm sure you'll remember, this was on the news, that there was poliovirus found in wastewater in North and East London, because vaccination uptake had become so low in our population, unfortunately. And what's really important to remember is that these infections are not minor. So often I have conversations with parents and they say, but measles is just a rash. But it can be really serious. It can cause things like pneumonia, needing, again, respiratory support in hospital. It can cause meningitis. I've got a patient who's older, actually, and they had that they've had complications from measles in the past. It can cause deafness. It can even be fatal. So it's really, really not a minor condition. And the symptoms can be really difficult to pick up. So it can be things like high fever, runny nose, cough, which at this time of year, I was in clinic this morning and lots of children have those symptoms. And it's also very contagious. So we know, for example, if we get a measles outbreak, with the low uptake that we've got, it will unfortunately pass on to lots of children very quickly. For COVID, the number of people that so if you were infected, you on average passed it on to 2 or 3 people if you were infected, but with measles, it's more like 15 or 16. It's that contagious. So really dangerous disease and really easy to pass on. And the good news is that there's a really effective way to protect yourself and others against measles infection, and that's to have the 2 vaccines, both at 1 year of age and then at 3 years and 4 months of age. And that gives safe and lifelong protection. And we know that because it's been tested. And that's the measles, mumps and rubella vaccine. So people often talk about, parents also want to know about the risks of vaccination. And I think it is important, particularly in a setting like this, that, I'm not here to say that any medication, including vaccination, is risk-free. It can cause side effects. It can cause flu-like symptoms. It can cause fever. It can be tender around the arm once the child has had the vaccination. An extremely rare complication is, and a side effect is, anaphylaxis, which is a serious allergy to the vaccination. And like I said, I think that that's probably 1 in a million type of cases. It's very rare. But what we do know is, given all I've said about how infectious measles and how deadly some of the infections can be, like meningitis, the benefits of vaccination clearly outweigh any risk of them. So I think I will hand over to Bryn now, who will talk through the schedule and a bit about how to have vaccinations, and then we can then move on to any questions and answers. So thanks, Bryn.
Hi there, everyone. So yes, I'm the Childhood Immunisation Programme Manager for City and Hackney, and I've joined this year to help City and Hackney roll out this programme, which you see on the screen. So the the childhood immunisation programme, as you can see, has lots of different vaccines. But as Tassim was mentioning earlier, one of the good things is that you can deliver multiple vaccines in one go, which means that you can reduce the number of appointments that you have to make and trips to the GP to get fully immunised. So it can be broadly broken down into the first 16 weeks, 8, 12 and 16 weeks are the key time points to deliver most of those vaccines. And then there are another round at 1 year of age and a final round at 3 years and 4 months, which is a booster before children go into reception in schools. And so, yeah, there's a few time points, but it can be broadly broken down into these time. Next slide. So the key ways of arranging vaccinations is mainly through your GP. GPs will have a record of the immunisation status of your child and will give reminders before those time points. And if it's missed for any reason, are really good at calling back and explaining that the child's overdue and making an appointment. Also having conversations with health visitors is a really good way to address any concerns, and they can help with booking appointments. And there are also community clinics that run and weekend clinics, specifically in Tessin, Springfield, PCN are really good at offering Sunday clinics when access might be an issue during the week. So community clinics and pop-up sites are also available in addition to GP appointments. And so for people that are expecting an appointment, knowing what to expect, it's really good to remember to take the Red Book, and that's the log of the immunisation history of the child. And that can help identify if there are any missing vaccinations and keep a log so that you can always show to a healthcare professional what the log has been, and also for yourself to be able to check and know what the status is. Also, just trying to stay calm during the vaccinations process with your child. The child will be a lot calmer if you're calm. So holding them on your knee during the injection or asking someone to do this can be really helpful. And the key message there at the bottom is really ask as many questions as you have around vaccinations. There's no such thing as a silly question. And then the final slide we wanted to highlight was all around the current immunisation data and uptake levels across City and Hackney, London, and wider in England. So on the right side there, you can see the England uptake levels of MMR and a 4-in-1 vaccine that includes polio, which are used as some of the key measures for childhood immunisation uptake. And you can see in England, there's been a bit of a downward trend across the board. There was a slight rise just before COVID and a dip again after COVID, which may indicate a little bit of vaccine fatigue potentially. But then you see in London and City and Hackney that the decline is a lot more steep. And there's research that kind of shows that densely populated areas, deprivation, high levels, ethnically diverse areas often have lower uptake. And in truth, there's multiple different factors all at play here which contribute. So it's about trying to understand the challenges that each different area is experiencing and working with everybody to try and address them. So we're hoping to see an increase with next year's data. There's a lot of work going into this, but it really requires everybody within lots of different sectors and systems to get involved and promote the message to help us increase the uptake. Yeah.
All right. Thank you, Dr. Cannon and Brian. That I, as a parent of a toddler, really found this information very useful, very clear, and hopefully this information exchange meeting today, as it's going to be published on our YouTube channel and further obviously advertised, will also help the increase of the vaccination uptake next year, hopefully. Any questions for our speakers? I've drafted a few myself. Catherine.
I've heard people who are, I suppose you might say, a bit anti-vaccination, talk about maybe mercury being in vaccines, about fetal tissue being something that's used. I don't know whether they're talking about it being used maybe in terms of research or something like that. Yeah, so I just wondered if you could sort of comment on that.
Thank you, Catherine.
Sure. Yeah, the mercury thing comes up quite often, and I mean, the truth is there is no mercury that's used in vaccines. They used to use it in the flu vaccine in a chemical called thermosyl, which is like mercury derived, but that was a preservative, and even that was completely safe to use. But they don't use that as a stabilizer anymore. So there's no mercury in any of the vaccines. As I said, it needs to go through a whole process. Every vaccine has to go through a whole process of safety. And they're really strict about what ingredient can go in, quite rightly. And yeah, you just have to, you have to be really careful what's approved, and that's something that there isn't any mercury in it. Fetal tissue, again, no, there's no animal products at all in vaccinations. There are one exception, and that's the nasal flu vaccine for children, which does have some processed gelatin product in it. And for those children who are from a kind of a vegetarian background, or who have objections because of say religion, not having any gelatin, there is the opportunity to have an actual flu vaccine, but in your arm rather than having the nasal flu vaccine. In development of vaccinations, there are stem cells that are used. So there is this kind of, from that, I think that misinformation that has come, that these immune system cells that are used in the testing phase, it's not fetal tissue, but it's to see what, because there's different cycles of research. So first of all, they test it in the lab to see what happens in cells. It's only when it's approved, then they'll move on to more animal testing. When it's approved there, then they'll start cautious human kind of testing on actual volunteers. So yeah, absolutely no products from human tissue or animal tissue in vaccinations at all.
Would those stem cells come from, say, placentas or something like that?
Yeah, so in the testing phase, they come from donations of cells for the purposes of medical research. But like I said, with vaccinations that we're using for children's immunizations, there's nothing new here. It's been, these have been established for decades. And so they're not even at the test phase. Yes, there's continual monitoring of all vaccinations, but we know that they're safe and they're effective. So actually, the monitoring is it being given to millions, if not billions, of children around the world. So that's kind of real life testing, which is the other part of scientific medication testing as well. Yeah.
Thank you, Dr. Khan.
Thank you.
Any further questions, Leah?
Yeah, just I want to ask, Doctor, any side effect of this vaccine, please? I have a child, so she's allergic to pork. So the gelatin might have any content as a religion. So I just want to know any side effect, any options, such as you mentioned now. So sometimes not clear when you go to the GP, they don't realize like this got maintained gelatin. So some of the flu vaccine as well, the flu jab does have like gelatin on it. So it's like needs to be clear for the public, like the patient, please. Yeah, thanks.
Yeah, absolutely. So yeah, like I said, there's the only vaccine that has gelatin in it is the nasal flu vaccine that goes up the nose for children. So if your child has an allergy to gelatin, then they'll be given the alternative, which is a standard flu injection that goes into the arm, and that does not have any gelatin. In terms of general side effects of vaccination, yeah, I always say that it's having a side effect from a vaccine is a good thing. What it's showing is that your immune system is actually fighting that fragment of the virus or the coat of the virus, or the inactivated virus, if you will. What it's doing is it's recognizing that there's an intruder there. It's then producing antibodies, and that does, in many cases, make you feel a bit unwell. It makes you feel under the weather for a day or 2 at most makes you feel like you've got a fever, like you've got flu-like symptoms. But that's, yeah, as I said, that can be managed with paracetamol. And if you're able to take ibuprofen, if that's safe for you to do so, then you can also use that. And so these are all controlled and measured and monitored and well-known side effects, but they're completely harmless, and they don't cause any long-term complications. What do cause long-term complications are the vaccine preventable diseases. As I mentioned, measles in 1 in 13 cases can cause serious complications, including deafness. So weighing up the risk versus the benefit, it definitely is in the favor of vaccinating. Measles, 1 in 13 causes complications such as deafness. It doesn't always cause deafness. It can be pneumonia and other kind of complications.
Thank you. Just to top up on what Leah was asking. So what you told us today was really clear, really easy to understand, but I wonder, considering how diverse is the population in Hackney, and that there are people whose English is not their first language, I wonder what kind of information parents are given in advance to make the informed choices for the vaccination, and how this is communicated with them, to them.
Yeah, I think so. I mean, it's a very good question, because we do have very diverse communities. So one of the things that we're keen, particularly in North Hackney, to do is a lot of community engagement work to work out what are the barriers for particular communities. Because what we know is that there's 3 types of barriers. Normally, there's either confidence, so people aren't very confident in vaccinations, in which case we do things like this. We talk one-to-one, and it was in one of the slides, but actually, you're always welcome to come and ask us questions as health professionals about vaccination. We won't, force you to have vaccinations. We're very willing to answer questions without the commitment of the vaccination. So trying to do things like that can help. And actually having health visitors support that also is really helpful. And we try and have information literature in different languages that are more community specific. So that's a really important way of trying to meet the needs of our communities. And actually, what would be really helpful is if from that point of view, if you feel that there are any gaps, actually, I'd quite like to know about that. If there's a community that you feel that is being neglected in terms of information access, that's something for us to work on. So really welcome any feedback about that. The other 2 aspects of why people can't have vaccinations or don't have vaccinations is convenience. So it might not be close enough to them, the clinic. It might not be at a suitable time, in which case what I'd say is to talk to your GP surgery, because now all GP surgeries and these primary care networks offer evening and weekend appointments. And we, for example, in Springfield Park, offer clinics for vaccinations every Sunday that you can book into. So there are ways of trying to get vaccinations outside of sort of the 9 to 5 hours. And the third aspect is the complacency. So we all have busy lives. There's other competing priorities, and life gets in the way. So and again, this is about having the continual awareness that actually vaccination is important, because we are seeing diseases that we really don't want to be seeing and that are perfectly preventable with vaccination, and we want to protect as many people as many of our residents. We saw it in, we're seeing it now with whooping cough, but we saw it particularly in the measles outbreak, where, as I mentioned, 400 children had measles, including a couple that were on intensive care. We just want to really avoid that from happening. And so it's really important that you come forward for your vaccination, or you bring your child for their vaccinations, but also to have their vaccinations on time. Because another key thing that, we were focusing on, Bryn was talking about, is a schedule has been developed to protect your child at exactly the right time. So babies have protection from their mum because the antibodies do transfer over in the womb. But around the age of kind of 3 to 4 months, they start to lose that protection. So that's why we start vaccinating, because that's the most important time for them to have these antibodies, these defenses against these really serious infections. So having them on time, often I hear parents saying, do you know what, my child's too young, I want to wait till they're older. But that's really dangerous for them, because actually they're still very young. They might be really vulnerable to these serious complications. So bringing them in on time, so starting at 2 months, so 8 weeks, and then 12 weeks, is really important, because that will help protect them in exactly when they're most vulnerable.
Right. Thank you. Fabian.
Hi, thank you. So I got the flu jab for the first time yesterday, and when I first inquired about it, I think I was told that it was available for free for over 65s. So my question to you is there a better age bracket that people should be getting the flu vaccine, or is it open to people of all ages? What would you recommend?
Yeah, so a really good question. So the flu cohort does change from year to year, and we normally find out in around January or February time for the next season who's going to be eligible for the flu. So this year it has been only for those people over the age of 65, all children who are aged between 2 and 3, primary school children, but then also anyone from the ages of 6 months to 65 who have got underlying health conditions that puts them at risk of serious influenza infection. So if they catch the flu, they're more likely to end up in hospital. So for all those cohorts, it's really advisable that you come forward and have your flu jab early on in the season. And normally we start rolling out the flu at the end of September. So if you're in any of those categories, so really young children, people over the age of 65, or those who have got underlying health conditions, you're particularly at risk of flu, and so it's really important to get it. In terms of the 2-3-year-olds, like I mentioned, it's quite good to have them vaccinated, because it can be risky for them, but also children are a reservoir of flu. It really, they do get it very often, and so they can pass it on to others in the community and to grandparents, as I mentioned. So there's an advantage there for them to have the vaccine. Over and beyond that cohort, those cohorts that I talked about, there is the option of having the flu. It wouldn't be on the NHS, but you can buy a vaccine from Boots, etc. Is that what, presumably that's what you might have done?
Yeah.
But that's completely open to you. That will protect you. It'll protect others as well. It's no bad thing to do. Some companies actually provide it as part of the company policy, because it's beneficial for the employee not to have flu, but it's also advantageous for the company because they'll have less sickness. So yeah, I think that if you're wanting to have the flu and you're not eligible for it, but you want to have it anyway, then please go ahead. You might have to pay sort of £10 from Boots to have it. It's definitely worth it for the complications of flu. And even if you're fit and healthy, it can be pretty miserable. You can be laid up in bed for a couple of weeks, and particularly coming up to the festive period, we want to try and protect ourselves to enjoy that period of time. So yeah, I think it's a really, really good idea.
Thank you.
Just to mention as well, the free NHS flu vaccine is available for carers as well. So to see mention for those that are sick, but those that are caring for those that are sick as well, and immune compromised can also get it for free.
People with asthma too, because I was asked if I had asthma yesterday, which I do, but there are different types of inhalers, and mine's very occasional. It's more of an allergic reaction. So, but had I had the brown inhaler, I was told that would be free.
Yeah.
Thank you. Very useful to know that it is available for carers free of charge as well. Thank you. And while talking about flu, I know we were talking about child vaccination, but Fabian already mentioned about him getting vaccinated yesterday. Anecdotally, we've been hearing from people who are able to compare their experience of having the flu with the vaccine and without having the vaccine. And they would often say, I had the vaccine and now I'm having the flu really even worse than if I don't have the vaccine. I wonder what is the explanation for that, and if there is an explanation really.
Yeah, I mean, I do hear this probably less frequently than I used to as the flu vaccine has become more and more advanced. I certainly used to hear it a lot more where people would say, actually, I had the flu vaccine and it made me feel rotten. And yeah, I think, you know, as I mentioned, that vaccines aren't without side effects and they might well make you feel under the weather. And this is similar to the COVID vaccine as well, where there were some people who are having COVID vaccine and were having really bad side effects from the actual vaccine itself. But for me, I think there's a sign there that actually, if you were to develop flu itself, you probably would be you will most likely be much worse than having the vaccination, because clearly your immune system is reacting to the vaccine. So I think, yes, it might well make you feel miserable for, you know, a couple of days, maybe a bit longer than that, but it's still unbalanced. It's all about balance and risk. And what we know about flu is that, kind of like we mentioned about measles or any other infection, it's not a trivial kind of infection. You can end up in bed for a couple of weeks and then have complications afterwards. It can lead to things like depression and chronic fatigue afterwards. So given all the risk of seriousness of the acute phase, so having things like lung problems with flu and the pneumonia that comes afterwards, plus then having a weakened immune system because your body has just been through a serious infection, and then the risk of complications, I would still say that the evidence shows that having the flu vaccine is much safer than not having it, even if you do end up with some unfortunate temporary side effects, smaller in comparison to actually developing flu itself.
Yeah, thank you. And my other question about vaccines, are there vaccines that are specifically offered to specific communities in specific areas, offered through the NHS, like tetanus, for example? I don't know if I pronounce it correctly. Yeah,
so most vaccines are part of the universal program, the schedule that's offered to everyone. And the main differentiator is age. So it's based on how old you are, what you're offered. And that's according to an evidence-based schedule. There are a couple of types of vaccines that might be offered according to risk. So TB, for example, if you are from a particular background or you live in a high incidence area, so somewhere like London is very diverse, there's more risk here of developing TB than there is in, say, the countryside in Wales. And so the risk is deemed to be higher here. And so babies are routinely offered TB, whereas they're not in rural Wales. There's also things like hepatitis B vaccine, which is given to some people, particularly, if they have kind of, some underlying risk factor that makes them more at risk of developing hepatitis B. Either they use, for example, intravenous drugs, needle sharing, or they have high-risk sex, for example, that puts them at risk of hepatitis B, in which case they will have a targeted vaccination because they have higher risk, whereas the general population tends not to have that risk because it's a blood-borne or a virus that actually also transmits through bodily fluids. So those are the kind of main two variations. So TB and hepatitis B would be, and then the third big example would be travel vaccinations based on what's kind of an endemic disease in the area that you're traveling to as well.
Yeah, thank you. Very useful, Dr. Khan. Thank you. Any more questions for Dr. Khan or Brian White? Because I have one more, if that's okay, but I don't want to be overtaking the meeting. Okay, I'll go ahead then. And this is a question for both of you. You mentioned about Hackney being one of the boroughs with the lowest uptake of the childhood immunization. And you mentioned about having literature available in different languages, but I wonder what else has been done to increase that uptake. Any specific pieces of work any ongoing work. I'm sure there is, but it will be good to hear from you as well. Thank you.
I can start seeing if you like. Yeah, so there's a whole program of work currently going on, and as I mentioned, there's lots of different roles and sectors that are involved in supporting this. So it's not just the GPs, but also the wider system. So early years settings, health visitors, secondary schools and primary schools, and collaborating with school nurses. So there's lots of different people that can help provide information. And it's about making sure that they have the right resources and can have those conversations and support the practices as well. But then there's also the work with communities. So, I mean, Tahseen's PCN is a great example of work done with the community in running additional clinics, but also pop-up campaigns where it's not just about vaccinations that are provided, but making every contact count approach where they invite people from oral health, and bike fixing and everything that kind of helps towards health, and generally including immunizations in that conversation. So there's a lot of work going on within the system and with communities, and then also for vulnerable groups, inclusion groups that are at higher risk, and working with those inclusion groups, such as asylum seekers and yeah, all those different inclusion groups to kind of improve the pathways and make sure that they're getting the right information and support that they need to access GP appointments. Yeah.
Thank you. Dr. Khan, anything to add?
Yeah, I mean, I think Bryn has outlined that really well. I think the other thing is just to say, again, I do genuinely mean this, that if there are particular ideas that actually people listening to this webinar have about how we could engage people around vaccinations, but actually also, I mean, vaccinations is one thing, but also general prevention, you know, whether it's vaccinations, cancer screening, you know, blood pressure, etc., diabetes. What do you think would work? Because, you know, the whole point of coming here and talking to you is that we want to co-produce, we want to make meaningful changes in our local health system to serve our patients better and help make our populations and our communities healthier. So we can think certain ideas might work, but in practice they might not be the right kind of idea. So we're very open to trying different things on imparting information,
Yes.
but also designing services to be responsive to what residents' needs are.
And we'll be definitely very happy to share any insights that we currently have or we are about to receive, because we are hopefully planning to start some work around access to services with the Orthodox Jewish community. And hopefully this piece of work will bring some ideas of how to communicate better with them or with the specific community, or how to express information better to them, or what they need in order to get the information better. So hopefully we'll keep you updated, and we'll definitely continue working on this. But yeah, until then, obviously, again, if we come across anything that we think might be helpful, we'll definitely be in touch with you again. Any further questions for Brian or for Dr. Khan? No? Well, in that case, I thank you very much. Oh, sorry, Catherine.
No, just to say thank you.
Yes, thank you. Thank you both for being here today and for providing so useful and really important information. We'll make sure that we publicize it as widely as possible. And hopefully next year we'll see increase in the vaccination take up. And we can meet again for another information exchange meeting. Have a good evening, and thank you all for joining as well. I really hope you found the information useful. And in a week time, I'll be able to share the recordings of this meeting with whoever booked their place for today. Thank you. Have a good evening.
Thank you.